Okay, good morning, good afternoon, or good evening, and welcome to this Global Health Network webinar. I'm Jo Black. I'm Director at the Sustainable Livelihoods Foundation, which is an independent, non-profit research and engagement organisation based in Cape Town, South Africa. I'm delighted to be here today to officially launch the ebook, Public and Community Engagement in Health Research, Openings and Obstacles for Listening and Responding in the Majority World. The ebook comprises a collection of 10 articles, including 6 original research papers, 2 community case studies, a methods article, and a perspective piece, which have been published together as a research topic in the journal Frontiers in Public Health. Collectively, the articles draw insights from Southeast Asia, Africa, and South America. And the purpose of the ebook is to contribute to understanding the challenges that obstruct meaningful integration of community voices in research design and constrain responsiveness to expressions of need and aspirations for change, as well as understanding the openings that allow community engagement to happen in LMIC settings. Please note, when you access the link to the research topic, which has been shared in the chat, please click on the download PDF button or the download EPUB button at the top of the page, and both of these links will take you straight to the ebook. I've hugely appreciated the opportunity to edit this research topic with Young Chia, Mary Chambers, and Deborah Nyirenda, who have been an absolutely fantastic team to work. I also would like to thank the Global Health Network team, especially Helen Matcham and Adam Dale and Deborah Nyirenda for organising and coordinating this event today. Before we get going with the webinar, there are a few housekeeping notes for us to run through. First of all, the webinar is being recorded, and the recording will be shared on the Global Health Network platform. And due to the number of participants, your camera and microphone have been disabled. With respect to communication, please use the chat box to introduce yourself if you haven't done so already, and to also use the chat box to directly notify the Global Health Network team about any technical issues you may be experiencing during the event. With respect to your comments and questions, please use the Q&A box. To facilitate the Q&A process, questions will be taken from the Q&A box only. We won't be using the raised hand function today, and we appreciate your understanding about this. You can choose to post anonymously in the Q&A box if you wish to do so. So to really fire up the launch event, we're going to be hearing from 4 authors today who will present the papers they have published within the ebook. And our authors are Gary Hickey, Kay Polidano, Kai Nok Tien Hung, and Alan Davies. And it's great to see that some of the other authors of papers in the collection have also been able to join us today. In the first part of the session, Gary and Kay are going to give consecutive presentations, each of 10 minutes, and then we'll have a 5-minute Q&A session in response to both of their talks. In the second part of the session, we'll hear consecutively from Tien Hung and Alan, who will also speak for 10 minutes each, and then we'll have a further 5 minutes for questions and answers in relation to their talks. I'm now going to introduce you to Gary Hickey and Kay Polidano. Gary is a Senior Public Involvement Manager at the School for Healthcare Enterprise and Innovation at the University of Southampton. He's currently developing the Agora Digital Centre, which is an online centre for connecting people with research. Gary is also a Senior Research Manager at the National Institute for Health and Care Research, also known as the NIHR, which is the UK's largest funder of health and social care research. Gary supported the development of NIHR's vision and goals for community involvement and engagement in global health research, and their podcast series, Spotlight on Community Engagement and Involvement, improving global health research through engaging with local communities. Gary will be presenting the paper, What Does Good Community and Public Engagement Look Like? Developing Relationships with Community Members in Global Health Research. Dr. Kay Polidano is a sociologist working in the field of medicine and global health. Kay's research interests cover physical and mental long-term conditions, stigma, and health services. Kay joined the NIHR-funded ECLIPSE programme as a postdoctoral researcher in public engagement and global health at Keele University from 2019 till 2022. Kay is now a resident academic in the Department of Sociology at the University of Malta. And Kay will be presenting the paper Community Engagement in Cutaneous Leishmaniasis Research in Brazil, Ethiopia, and Sri Lanka, a decolonial approach for global health. Over to you, Gary.
Thank you very much, Jill. Thank you, Adam. Hello, everyone. Absolutely delighted to be here. And I apologise for the poor lighting where I am. I've honestly got all the lights on. It's just clearly one of those odd things. I'm going to share my screen now. Okay, so this is my presentation. What does good community engagement and involvement look like? And I just want to stress that I am indeed one of many authors on this paper, and they should also, of course, share in the credit of this. But there are so many authors that I really can't fit them in on one page in a 10-minute presentation. I'm not going to go into the methods in any great detail, but just to let you know that we funded a variety of projects in lower and middle income countries, and we undertook an analysis of 139 progress reports received on those projects at the National Institute for Health and Care Research. And then what we did, we had a workshop with 11 people, various community engagement specialists and members of the public to look at the analysis of those progress reports. And what we did, we then came up with 6 key features of good community engagement and involvement. And what I would stress is that these key features, they're not mutually exclusive. They intertwine and indeed they overlap. And hopefully that will come through in my presentation. And I'm going to present these now. And just to bear in mind, I think what we've used these key features for is as a springboard for some work that my colleague Doreen Tembo is leading on to actually try to develop some principles, some overarching principles for good community engagement and involvement. So I'm going to take you through each of these key features. So this one's adapting to local cultural norms and customs. So this is very much underpinned by respect for cultural differences, for local culture and indeed community dynamics. And it's something here about us needing to be conscious about what works and what is appropriate in different countries and different communities. So the example here is a quote from the workshop we had, was about using certificates to encourage people to get involved in participating in a project. And there's something here about the ceremony that is clearly quite important in some countries, perhaps not in others. So it's about respecting cultural norms and customs as a way of getting people to participate in the research. Next slide, please, Adam. Respect. Now, treating community members with respect. Now, of course, this is very easy to say, and I hope that we all try to do this, but I think there's various aspects to this about what this really means. So there's something about valuing local skills and knowledge. Local people and partners, they're going to have insight into the power dynamics within a community and indeed between communities. So something very important about we listen to people and we have that respect. And indeed, when we did the workshop, there was an example that someone gave where perhaps people didn't respect that local skills and knowledge, and where it was basically researchers brought together 2 tribes who, let's just say, had a history of disputes and hostilities, and they brought them together into research projects against the advice of local communities. And of course, that project did indeed fail. I think it's also, though, about challenging hierarchies of knowledge. This idea that somehow research knowledge is perhaps superior or above the knowledge perhaps that local communities have of their communities, their customs, etc. And there's something here about challenging that and moving away from that and recognizing that they are just 2 different types of knowledge, equally as important. So that's respect. Next one, please, Adam. Acquire permission from and work with local gatekeepers. It's so important, as I'm sure that everyone on this call knows, that to gain access to community and to give the research some kind of legitimacy, And if you look at the quote here, trying to engage the community without engaging the local people ministry was a non-starter completely. And that's really, really important. And sometimes, of course, access can be denied by the powers that be. And this might, of course, be for very, very good reasons. There might be things about concern about the welfare of the community, the burden that we're placing on the community, the appropriateness of the research. That said, of course, we have to recognise perhaps that sometimes access can be denied for less benign reasons, let's say. And again, in our workshop, an example came up of people being denied access to community because they were trying to work with local politicians who were in opposition to those that were in power, and they didn't get access to the community. So we do have to bear that in mind as a challenge. Next slide, please, Adam. Community involvement in and ownership of the research. There's something here, I think, about the legacy of the research. We want the research and its outcomes to have an impact beyond the lifestyle of the research. And given the community, I think, some stake and some responsibility for the research, I think, can help with this because they have ownership of it. It is their research. They shape it, and we want them to take on the outcomes. And I think that's very important. Next slide, please, Adam. Avoid overburdening communities. This is something that I know certainly I've been guilty of in the past. I'm sure there's many people on this call have too. As researchers, I think we often go back to the same communities again and again. I think we all understand why this happens. We've developed very strong relationships. We like the people. And of course, it makes life much easier for us as researchers by going back to the same people. But sometimes I think we need to be careful about the burden that we place on the community and perhaps reach out and work with other people. So it's that balance, isn't it, between developing relationships and not overburdening people. Again, something very easy to say, but something we don't always practice in reality. Next slide, please, Adam. Investment in long-term relationships. So whose rights are we prioritizing? Is it the longer term goals of the community, or is it the shorter term goals of particular research projects? And again, as researchers, there's always that danger, I think, of us zooming in when we want to do a research project, when we want something, and then quickly zooming out again when we finish the research project. Now, I know this is difficult because a research project does have a finite and often a very short life cycle. But I do think we need to think about longer term, less transactional relationships in our research. And I think those longer term relationships provide an opportunity to develop trust, to address perhaps the power differentials that we know that exist. And I come back to this idea of legacy again. And clearly, of course, funders, I think, have a role to play here about providing the investment that enables those relationships to build and to flourish. And I think that's really, really important that we do invest in these long-term relationships. Next slide, please, Adam. So that is our 6 key features. We are also doing a podcast series that Jill mentioned, and you can find that, and I've sent Adam a link for that. Hopefully that can be shared with you. And again, where we explore what did and didn't work in terms of community engagement and involvement. And along with this article, along with these podcasts, it's the beginning, as I say, of a piece of work we are doing, and my colleague Doreen Tembo is leading on, about developing some overarching principles for good community engagement and involvement, which hopefully can be used as guidance for people as they're undertaking their research. And I just wanted to leave you with a couple of questions as the audience. One is, do people recognize these features that I very, very briefly outlined? And also, indeed, what, if anything, is missing? And I would really welcome people's views on that. So thank you, Jill. Over to you.
Thank you, Gary. Do we have any questions? I don't see anything at the moment in the Q&A box. So would anybody like to respond to the questions that Gary has raised? Perhaps any of our co-editors from the research topic who are with us today? Okay, so thanks, Gary. I mean, from my side and from my experience of being a community engagement practitioner and scholar, these do look very familiar. All of these different frames that you have, themes that you have come up with through the research. I just want to ask you about the ownership question. So, in terms of ownership, what came out from your analysis about the best ways to promote ownership of research with community members?
I think the first thing, thanks, Jill, I think the first thing is obviously involving people right from the very beginning of the research, as opposed to bringing them in halfway through, perhaps, or after the question has been designed. So there's something about making sure that the research from the very beginning is of relevance to that community. And that does involve people being in from the beginning. And then there's something for me about recognizing the power differentials that do exist between researchers, between professionals, and perhaps between people in the community. And I think there's various ways that can be addressed, or at least in part addressed. One is perhaps is undertaking the research or meeting with those communities in a setting that is either neutral or it's their setting, as opposed to perhaps inviting the communities into our space, if you like. And sometimes I think that can be very off-putting for people, and indeed perhaps intimidating for people. And then the last thing I think, and I'm sure there's many other things as well, and I think this is tricky, and it is investing in that relationship development. And as I say, I do think that's tricky, because understandably lots of research will say, well, where's the funding for this? Where's this going to come from, of developing those strong and those trusting relationships? And I think that's a challenge, I think, for all of us, including funders.
Okay, thanks. Thanks, Gary. There is one question now that's popped up in the Q&A box, but we're going to move on to Kay now. And then we will come back to any questions in the Q&A. So over to you, Kay.
Hello, everybody. Thank you, Gary. And I think actually that my presentation follows quite nicely onto yours, because I will be touching on some similar themes and how they actually manifested in our project. So today, just to provide a bit of context of our article, I'll be just describing the project that we were working on. So this is Eclipse. It's an NIHR funded applied global health program, which is still ongoing. And basically it all revolves around cutaneous leishmaniasis. And this is a parasitic skin disease, which can cause visible lesions, and they can be quite stigmatizing. And this parasite is especially prevalent in low and middle income countries, and it is associated with extreme poverty and areas of conflict. Now, what we are trying to do in Eclipse is to especially address the psychosocial impact of this disease and the stigma associated with it, and also try to improve the patient journey. And our project is being conducted, it is being led in the UK, but is also being conducted across Brazil, Sri Lanka, and Ethiopia. So we've got 3 different continents. And obviously, with it being such a huge theme, we've got quite a lot of interdisciplinary backgrounds as well to help us do this. And basically, we are doing both quantitative and qualitative work to establish the groundwork, and then we are in the process of developing interventions and also evaluating them. Now, let's talk about why. Let's talk about community engagement. So this is at the heart of our project, and basically, our mission just departed from the view that in cutaneous leishmaniasis research, but also beyond in biomedical research more broadly, there's this idea that there will be a researcher or a group of researchers parachuting into a community. They will collect data whenever they want, however they want, and then off they go. And this is naturally what we really try to steer away from. And basically, just 3 really guiding principles for the way we want to implement community engagement is that first, we really want to amplify and embrace community members' experiential knowledge and try to break down the knowledge hierarchy that Gary was just mentioning. The other one is to really try to build long-term sustained partnerships. And then, with it being such a varied, we have so many varied countries, is that our engagement needs to really be adapted to the setting where we are carrying out our work. And just to provide a bit of overview of how we are actually engaging communities, we have 2 different types of groups. So one are what we call community advisory groups, where they are in the village levels and the study settings, and they bring together people with cutaneous leishmaniasis, their families, but also community leaders, religious leaders, and they provide input or make joint decisions with us on how we are conducting research in this project. And then we've also got some groups at a regional level with public experts, with experts and NGOs and so on. So here, just to provide some pictures, just to help you visualize how these community advisory groups operate. Now, this idea is that we do have one model, but we do appreciate that it can't be a one-size-fits-all. So here, for instance, it's in Brazil. These are photos from our engagement in Ethiopia, and it looks very different because obviously the context is different and the infrastructure is different. And these are some photos from Sri Lanka. Now, as I said, and as we were saying, community engagement needs to start from the very beginning, each phase of the project has different objectives in terms of how we are engaging community members, and we are also really trying to monitor and evaluate our engagement as we go along to make sure that the community members are really getting something out of it, and to see how we can improve. Now, our article, which I will be presenting today, focuses on our results from the first time point of our evaluation, and that is covering the first 18 months of the project. And basically, the data underpinning it comes from the participant observation, from interviews and discussions with the members of our KEGs. And in the article, we touched on 4 different points. However, I do not want to really go through each of these headings, since you can really read the article yourselves. Rather, I just try to tease out some challenges, dilemmas that we faced, and the lessons learned from it. And I will be talking about 6 issues. But first, when I was preparing this presentation, I realized that what our article tells is really a story of how we went into communities and recognizing that at that point we're uninvited guests. Community members had never heard of Eclipse. They had never seen us before. And I think it's good to acknowledge this idea of being uninvited. I think it engenders some humility in knowing that trust and credibility will not just appear spontaneously out of nowhere, but we need to work through it to become trusted partners with them. But it also touches on our article the constraints in which this is done, in terms of funding and regulatory bodies, also the socio-cultural context of communities, and various external events which can happen during a project. I won't be taking a lot of time on this because we've already emphasized it, but one crucial element of having successful engagement is that you lay the groundwork, that you do the preliminary work. Now, in Eclipse, we were lucky because we got we involved the community members from the very start, even during the grant development stage. Our funder gave us a small pot of money to actually visit some of these communities and talk to community members. And this, I think what is important is that this preliminary work is really a two-way familiarization process. We want to understand what the community needs and priorities are, but at the same time, it is a brilliant opportunity for community members to get to know us and to really know why we're there. And the second point is this idea of expectations. When we go into communities, it might be a blank slate for us, the relationship, but for community members, there's often history, there's a legacy. And we've noticed, for instance, in Ethiopia, we've encountered a bit of resistance. You know, community members told us, well, researchers come and go, but nothing changes. So what is different about you? And which is a very valid point. And I think what is tricky is, for instance, in Sri Lanka, then we found the exact opposite. The university was very highly esteemed. The community members were very enthusiastic about the research team being there and that we're helping them. And I think it's quite important to get the balance right. So you want to reassure community members that you've got their interests at heart and that, you know, you do have good intentions, but at the same time, you can't really overpromise the benefits of a project, because then that's gonna, you know, create disappointment and broken promises again. And I'm not going to read this, it's quite long, but I just wanted to really show you a scenario from one of our KEG meetings in Brazil. And basically, one participant, one community member, she was questioning this idea that this project is participant-led. And she said, you know, you come here, you are telling us that the project is not yet set and we are going to have a voice, but there is, you know, there's already a plan, you already know what you're going to do. And anyway, we managed to reach consensus on the role of community advisory groups. But the reason why I wanted to share with you this is that one lesson we've learned is that resistance sometimes can be good. If handled respectfully, it can be quite productive. First, it gives you accountability for what you're doing. And second, it actually helps to dissolve these hierarchies between the research team and the community members. And I think it also challenges this idea that the community is always, you know, disempowered and that we're saviors and so on. What we've seen is that they've got a lot of agency and they're not afraid to actually disagree with us. Obviously, we already know this, that promoting a friendly, non-hierarchical atmosphere is the way to go, and this really confirmed it. And what our participants, for instance, was like, you know, even from the clothing that you wear, or from the seating arrangement, or the activities that are organized within these meetings, that they go a long way. But on the flip side, there's also the challenge that, I mean, power dynamics, you are trying to dissolve those hierarchies, but it might be a bit unrealistic to claim that, you know, this can be done to the fully. And what we've noticed that the power dynamics sometimes are deeply entrenched into the communities themselves, into the local customs and, you know, into the sociocultural environment. And we've noticed, like, one of an interesting reflection that we had is that, for instance, in Ethiopia, in our community advisory groups, first the women tend to be sat at the very back, and then the men sit in the front. And the only chairs that they had, they gave them to the research team, and they sat on the floor. And that is not really, upon reflection, quite within the ethos of this inclusivity and equitability and the solving hierarchies. But it's tricky because obviously you want to respect sociocultural norms. You can't just go in and challenge, and finally, adaptability. I think everybody can agree who has been conducting research in the past few years that you need to be adaptable because you don't know what's going to happen. Social, cultural, and health priorities are not fixed. The pandemic is a case in point. For us, it happened in the very first year of our research project, which is when relationships, the most crucial phase when you are trying to develop relationships based on trust. We had some successful activities which need to be celebrated. Unfortunately, in Sri Lanka and Ethiopia, we had to interrupt our engagement completely. But in Brazil, for instance, we tried to convert this online. We had socially engaged artists. We co-produced videos with our community members. And although they were not focused specifically on our project, it was really crucial to help build these relationships. And as if a pandemic was not enough, then there was a civil war in Ethiopia, an economic crisis in Sri Lanka. And I think what is tricky and what we're sort of trying to navigate is that obviously you've got obligations with the funder, you've got obligations to continue to complete the project. But at the same time, you need to take a step back and you need to sometimes reassess your priorities. With these changes also come shifting priorities. We can't expect that a disease caused by a sandfly is the top priority of the community who has just experienced an armed conflict. So that is where we're at.
Thank you so much.
Yes, thank you.
Sharing your talk with us. I'm very, very sorry. I'm going to have
no,
to
that's okay. That's okay. I was
to end there.
But
we do have time for one question at the moment, and there is a question in the chat, Kay, which perhaps you would like to respond to. And the question is, if the research project targets more broader health conditions, such as hypertension or diabetes, and there is no existing organised community or patient groups in the country, can we think about creating such organised groups as part of research projects in order to have the voice of patients and communities in the research and for the policy change as well, and to keep the outcomes sustainable? Would you like to respond to that question, Kay?
Yes, I think it's actually also what we had to go through, which was our main challenge in the beginning, is that there was no pre-existing structure, for instance, support groups and so on. So you really have to start from scratch in building these groups. And also on that point is that we didn't want just to create a group for just the lifeline of the project. We want to make it sustainable and long-term. So I guess two important points are that the recruitment strategies of creating these groups and going to trusted people, and it takes time and it takes trust. And the second is that element of ownership as well, is that it is not just the research team convening these people for this project, but it's the people themselves who are going to these groups and who are leading the activities.
Okay, thank you. Thanks very much, Kay and Gary. I would now like to introduce you to Kai Nok-Tien Hung and Alan Davies, who are going to be giving us the next two presentations in the webinar. So Kai Nok-Tien Hung is a graduate of the Diplomatic Academy of Vietnam. She's currently working as a research coordinator at Oxford University Clinical Research Unit in Hanoi for projects aimed at reducing the inappropriate use of antibiotics in Nam Dinh province in Vietnam. In the last 3 years, Tien Hung's research has focused on community-based interventions to engage people in science-based and practical knowledge, attitude, and behaviour related to antibiotic use. She has a strong interest in qualitative research methodology and enjoys using her skills to contribute to raising the thoughts and feelings of participants in OCRA's research to understand more about their behaviours and to promote behaviour change. And Tien Hung will be presenting the paper Challenges and Lessons Learned in the Development of a Participatory Learning and Action Intervention to Tackle Antibiotic Resistance Experiences from Northern Vietnam. And Dr. Alan Davies, has 2 decades of experience of leading engagement programs and initiatives across a range of countries with expertise in good participatory practice for clinical trials and youth engagement. He has broader experience in leading engagement in diverse global locations and in multi-country projects in Sub-Saharan Africa, Southeast Asia, and South America. Of note, he leads a WHO technical working group on good participatory practice for multi-country solidarity trial of COVID-19 vaccines. And Alan will be presenting the paper Evaluating and Engaging using participatory video with Kenyan secondary school students to explore engagement with health research. Over to you, Tien Hung.
Okay, thank you. Hello, everyone. My name is Hương. I'm from Vietnam, and I'm working at research coordinator at Oxford University Clinical Research Unit. So at first, let me share my slide with you first. Yeah, so now let's start. Today, I'm here to share with you about some of our experiment in conducting the some of the communication engaged activity using the participatory learning and action in some intervention related to tackle the antibiotic resistance. And my sharing today will include in 3 parts. The first one is some introduction. I would like to give some background information and some about the AMR, about AMR situation in Vietnam, and our study for name photo voice. And the main part, I will give you some challenges that we met during the time we implement our projects and some lessons learned. And the last part, I would like to give some what's next. How could we apply our lesson into other projects for our future project, as well as how could you or can apply them for some of your communication engaged activity. Now let's go to the first part. For the in the first part, introduction, first I would like to give you some background information so you could have an overview about the context and the situation of AMR in Vietnam and our projects as an effort to solve AMR in Vietnam. As you know, antibiotics and you know that antibiotic use in the community for human and animal is high in Vietnam. And in this so we believe that we need to do something to solve these complex issues. So we choose Nam Dinh to province. It is located in the Red River Delta in the northern of Vietnam. We choose this place because they are they have a high level of antibiotic use in community, and is known for like a hotspot of AMR in Vietnam. Through our desk review, we found that there is a huge need to improve the understanding and change the behavior of the antibiotic consumer here by some of the community engagement approach. And so we decided to use the participatory learning and action approach, which aim to engage community stakeholders in order to produce a meaningful social change. Here we would like to change the behavior of the people in using antibiotics, and so that we decided to conduct a large-scale One Health trial with the collaboration across many sectors. And one component is that we call it photo voice. And we would like, we conducted the photo voice, we would like to figure out some of the challenges and the lesson learned from this small component, and then we can apply them into a larger scale, that when we have in northern Vietnam, that our future project, we would like to share some of our findings so that other researchers can apply into their community engagement activity. And for the photo voice activity, I want to give you some other information about the design and some information so you can understand more about the lesson that we figure out later. And the photo voice, we want to use photo voice as a tool to visually explore the issue of antibiotics and AMR in the community. And photo voice method, it means that we will give some basic information, and we ask some of the participants to take the camera and take the photo to relate it into the situation, how they use antibiotics, how could people around them to use that to raise awareness about the current situation, about the antibiotic use and the AMR in the community. So we have 26 participants from the farmer and woman group in total, and in the we have in total we have 7 meetings with them from the beginning, like introduce about our project, about the process, give them camera so that it will take some time for them to take the photo. And in the end, we celebrate some exhibition to show the results, their photo with the community. And then we have a one wrap-up meeting so that the participants not only share their result with the community, but also with some of the policy maker, so that can raise awareness in the community. It's the arm and the result of our study. And one more point I want to mention here is that in this project, we work with a multi-stakeholder, and we have the stakeholder including the National Institute of Healing and epidemiology is at national level, and we also have some other stakeholder at the local authority inside and outside of the health system at provincial, district, and commune level. So with the multi-level stakeholder, that is create a lot of challenges for us that I would like to share with you later. So yeah, that basic information that I want to give you first, and now we can move to the main part, is that the challenge and lesson that we learned. The challenge we identify, we will group into the 5 main themes. You can see on the screen that the first is the understanding the local context. The second theme is the stakeholder relationship and development. The third part is the participant recruitment and the building trust and motivation, not only with the participant, but also with the stakeholder. And the last one will be engaged with the topic of antibiotic and AMR in the community. But because of the limit of time, I go to each of the team, but some of them will go quickly and some of them will go slower. Then the first theme I want to share with you here is the understanding the local context. On the way we prepare and implement the community study, we found that it's important to understand the local context. And I think it's a very, you know that in on of the project, we know that we need to understand them first. But here we find a lot of challenges when we would like to understand them. That first is that there limited information on them. And the one thing I want to share with you here is that we will honor it at Vietnamese. First, we don't use the same language. It's not kind of language, but because the action. I'm from another part of Vietnam, and most of our researching coming from another part. And when I go there, we go there. The one thing that we figure out is that we have a lot of problem on understand their local language and practice, and it will create a lot of problem for us. So we are not familiar with their local terminology, their local language. They use some verb or some, so we did, one of our solutions is that we decided to be one of the local vocabulary. Yeah, so I think you can apply it into all of your research when you go into one area that you are not familiar with, not only within the foreigner area, but also inside of your countries with the difference of the action. And there, so and one find in the way that we figure out, try through our discussion and engagement with the participant, we gather more local information and learn the context specific term and information, and something that will support it a lot through in the way that we learn the language. Yeah.
So can I ask you to please wrap up in the next 30 seconds to give our last speaker his time? Thank you so much.
Okay. Is it okay?
Another 30 seconds to wrap up, please.
Yeah. So, so to wrap up, because of the limit of time, so I would like to go to the web next. It means that in the conclusion and how we apply our okay, in that how could we apply the finding on the lesson we learned into our project? In the I think that the lesson will be important for our future project. We call it a larger One Health trial and other participatory action oriented approach to address AMR not only in Vietnam but also in other parts of the world. And so to but the limitation of our study also have some of the limitation. So we, in using photovoid methods and the participatory learning and action approach, so we need to solve some of the limitation before we can apply them into a larger scale or something like that. So the limitation, the first limitation we would like to share with you is that the we found some participants have a lot of ideas to improve and scale up intervention activity, but because our study was decided each year, they only give their voice on how the situation is happening. So we don't have, it's only the first phase of the participatory learning and action. Like that, we will learn about what is happening, but it is not the whole circle of the PLA. So we hope that in the next part, when we can apply what we are learning, what the community have raised their voice related into what is happening related to antibiotic use and AMR in Nam Dinh, in the future, we can apply.
I'm sorry, I'm so sorry. It's such a rich presentation, and I know you have so much to share. It will be shared with the audience, but I am going to have to ask you now to please end there so that we can bring Alan in for his presentation. Thank you so much for a very rich and very insightful talk today. Over to you, Alan.
Okay, so I'm going to talk about work that was done in 2015, 2016 at the Khemri Wellcome Trust Research Programme, where I was based for about 17 years. And it's about engagement with Kenyan school students. So the Khemri Wellcome Programme does a range of research. It's a large research institution with probably about 800-900 staff, and it does clinical trials, health systems research, social science, immunology, a broad range of research. And to support and facilitate that research, there's a community engagement strategy with lots of activities like community theatre, a radio programme, community visits to the laboratory, community advisory boards, and they're all broadly aimed at strengthening mutual understanding between researchers and the community. There's also a school engagement programme, which I was involved with for over 10 years. And it comprises activities between about 4,000 students every year across 50 schools in Kilifi and also Nairobi. And the activities are science clubs, competitions, lab tours, youth advisory groups, and that kind of thing, really. And they're broadly aimed at raising student awareness towards research, raising students' awareness of careers in science, and also incorporating student views into the way research and engagement is done. So we use mixed methods to evaluate this program. And alongside qualitative and quantitative methods, we used participatory video as one of the methods. So this kind of broadly involved handing cameras and microphones and that kind of equipment to 4 groups of students in four schools. Sorry, a group of students in each of the 4 schools. Having a training workshop where they learned how to use the equipment. And then there was an 8-week follow-up. The students were asked to make films about their experiences of research and their experiences of engagement, and also about their aspirations and achieving their aspirations. So the films were shared with school audiences, with the Ministry of Education, and with researchers. And the data, quite simply, was transcripts from the footage, but also observation notes, which we conducted over the process, over those 8 weeks. So just a bit about the 2 of us who did this work, who did the field work. Me, at the time, I guess I'm still a white British man, but at the time I was in my mid-40s. At the time I'd lived on the Kenyan coast for over 20 years. I'm fluent in Kiswahili. I'd also been a science teacher in Kenyan schools for 9 years before this, and I'd managed the school engagement program for 7 years. And I had some experience of participatory video. Nancy, who's working with me, was a Kenyan woman. She's still a Kenyan woman, but at the time she was in her mid-20s, from Kilifi itself. She'd worked for the school engagement for 2 years, fluent in Kiswahili as well as other local languages, and had some experience of qualitative research beforehand. So some of the findings from the participatory video broadly support the evidence that was gathered through surveys and through focus group discussions, that the activities were novel, they enjoyed, they raised awareness of health research, they raised awareness of research in science, and students described researchers as role models, broadly speaking, and aspired to similar careers. That one, let me just read one of those quotes there. My visit to the KWTRP laboratories to see microorganisms being cultured has inspired me to become a microbiologist. And that was quite a common quote across the schools. So taking a bit of a sideways step to look at participatory video as a methodology. I mean, it's actually a technical, you have to have a lot of skills to be able to do this kind of methodology. You need to be able to facilitate workshops. You have to have some skills in filming and editing, but also qualitative skills. And it's also quite time intensive. In this, we worked with 24 students over an 8-week process, over an 8-week time period. There's also acquiescence bias. In other words, that the fear that the students may tell you what you want to hear, but I think that's also true in qualitative research and surveys. On the other hand, we felt that participatory video would be a really enjoyable method for students to learn about making films and to basically have a bit of fun with the camera. The 8 weeks did enable us to build a strong rapport with students, but it also offered us an opportunity to kind of look at engagement as a kind of ethnographer in a way, to spend some time at the schools and have a look at engagement as it was carried out in situ. And it kind of raised a lot of unintended outcomes of engagement that we didn't know about before. For example, lots of students felt that despite being shown where the blood samples were stored in the laboratory, lots of students felt, even at the end, thought that they were for blood transfusion. Students interpreted research as healthcare. And the other thing that we noticed was that some students who were not taking part in engagement activities felt jealous. And it's kind of hard, really, because if you're engaging with schools often have, you know, over 1,000 students, and it becomes really impractical to try and engage with everyone. So, you know, some students have to miss out on that. So, okay, it also gave us some insights about the context in which school engagement took place. And if you forgive me, I'm going to use a kind of an analogy of a bookshelf where where aspects of students' lives are represented by books on a shelf. And of course, we as researchers have school engagement as a kind of central thing. We think, yeah, that's really important because, you know, it can offer students an opportunity to share their insights and form the way that research is done in a way. But of course, from the students' point of view, they have other activities that are going on. We found that these were kind of quite distracting to the participatory video process. They had exams, they had different clubs, musical festivals, football training, that kind of thing. But also they had concerns, like some of the girls often experienced sexual advances on the way home from school, whether there'd be enough money for school fees, drugs being sold at the school gate. And from our point of view, you know, some of these are definitely obstacles to engagement. But of course, from the students' point of view, these are real priorities and concerns. And, you know, school engagement just fits just as one book on that really crowded shelf, really. So another thing that this brought about is, you know, what is school engagement? What is the benefit of that? And what are the benefits according to who? So from our point of view as scientists, we think that learning about science careers, local research, or, you know, being able to shape the way in which research is done with children are really important and kind of really important benefits of engagement. Whereas a teacher might think that, well, okay, if it's not going to improve the student's grade, then, you know, what's the point of doing it, really? And from a student's point of view, you know, going on a school trip, whether the activity is interesting or entertaining, getting some nice food, having a go on a laptop. And of course, some students would just rather be doing something else. So, you know, what does all this mean? So I guess, I mean, as researchers, we can get really preoccupied with this thing about, you know, okay, we've got to try and incorporate students' views into the way research is done, and that's important. But what I'm saying is that, you know, if we don't take care of these other things and the benefits from the point of view of teachers and students, then they're going to become obstacles to engagement. So again, so what, I guess, at the end. So what we're saying in our paper is that engagement, because students give up time, and extracurricular time is as important as curricular time. You know, who's to say that netball is not more important than you know, science research and that kind of thing? Of course, these things are really important. And so researchers have to be mindful of that time. But also engagement, I think engagement practitioners have to be really careful to take care to plan activities in consultation with teachers to make sure that they're beneficial from the students and from the teacher's point of view, and that they're high quality and enjoyable for students. And that's me. Thank you very much. Over to you, Jill.
Thanks very much, Alan. We're on 2 minutes past 12 now, and I see that some people have had to start leaving already. But perhaps if I can just, I see the Q&A box, the one question that remains there has been answered by Kay. So I'd just like to end off with a question about from all of the presentations today, and thank you all very much. They've been very, very rich from different parts of the world on different topics using different methods. It's been a very, very insightful learning process. Would any of you like to comment on what this means from your perspective on guidelines going forward, in terms of how guidelines need to be adjusted, or how we need to be thinking about doing guidelines perhaps differently for community engagement. Over to any of you to answer that last question from me.
Happy to kick off, Jill. Just my thoughts are this, that I think it is possible to develop some guidelines. I do think they would have to be very, very broad principles, and how those principles are interpreted, of course, varies from situation to situation, because there isn't, as we know, a one-size-fits-all approach. But I think it would benefit all of us, I think, to have that framework, if you like, that could guide how we undertake our research. So I'm not sure anything would necessarily change, but I think I would take all this information on. I'm sure my colleague Doreen, who's on this call, I think, would be taking some of the notes here, and we would be using that to hopefully influence the guidelines that we are trying to develop.
Okay, thanks. Any other responses, or any other last comments that you want to make? There was a lot there. I think the aspect of policy engagement is incredibly important, because that's how real change can be driven on the ground in very practical ways. And also the importance of the decolonial approach in research engagement, and the fact that one size doesn't fit all, and you have these very, very different scenarios in very different communities. So if any of the speakers have one last burning comment that they'd like to make on those topics, then please feel free before we close the webinar for today.
Just a quick one from me. I mean, I think in all these presentations, what comes out is, that there's undeniably power differences between communities and researchers, and we just, as engagement practitioners, we have to really make the effort to kind of try and flatten those. I don't think we probably will ever flatten them, but at least we have to try and make every effort that we can to enable people's voices to come through.
Absolutely, Alan, thank you. Tian Hong, do you have a final comment you were hoping to make?
No, I don't think there's any comment, but I would like to say thank you to all of you, and we close it at the end of the seminar here. So yeah, I would like to say thank you for the organizer, as well as for all of the participants here. Yeah, if you need any other information, you can figure out our article in the application, that in the link. Yes. You can find the link for all of the article that we are present today. Yeah. So.
Yeah, all of the papers, of course, are available in the ebook on the Frontiers link that was shared earlier on at the beginning, if you would like to find out more. And of course, our presenters are all contactable as well at their institutions. So I'm going to close it there. We're a few minutes over time. Thank you very much to everybody who has stayed on the webinar. A big thank you to all of our speakers, to the organisers, and again to the topic editors, my co-editors on the ebook. I wish you all a very good rest of morning, rest of afternoon, rest of evening. Go well and goodbye.
Bye-bye. Thank you.
Bye, everyone. Thank you.
Bye.